Hi, everybody. This is Barry Diamond. I'm not coming to you today as a real estate advisor, but simply as a member of the community in North Monterey County. I'm fortunate enough to know a gal named Gio Carducci. She's a longtime friend of my wife for about 30 years. They were both trauma nurses together for a long time, and Gio actually has worked and done consulting work for the Center for Disease Control for the last 5 or so years, flying around the country, being on some of the major cases of infectious diseases and outbreaks that have made the headlines. She's got a master's degree in infectious disease and super knowledgeable. So I thought I would call her. Her and her husband Shannon live in Idaho. They're good friends of ours. They come down every Thanksgiving to Prunedale and hang out with us. They're almost like members of our family. But I thought it would be interesting to have Gio on this morning, and we're actually going to do a Facebook Live in a few days as well. If you've got some questions that you want to ask her specifically, I would consider her an expert in infectious disease control. And so anyway, we're going to do a little interview with her today, and she's just going to cover some of the basics. As we know, today, Saturday, March 21st, 2020, of where we're at with the coronavirus and what the next week or so is going to look like. Okay, here we go. Just tell us who you are and what your background is, your experience with the Center for Disease Control and Infectious Disease in the United States.
I am a nurse and an epidemiologist and also a board-certified infection preventionist. I've been working in healthcare for over 30 years. I was the state HAI coordinator for the state of Nevada, did a lot of outbreak investigation and a lot of work keeping healthcare facilities safe. Then I retired and did contract work with CDC and CMS and government facilities, doing the same thing, preventing outbreaks, helping with outbreaks, and gathering information on infections and what we can do to prevent that. So I do have experience going around the country and looking at infections and a lot of prevention.
Here we are, it's March 21st, 2020. What's your pulse on kind of the current status for coronavirus and where are we headed? What's the next week going to look like?
We're in a place right now where we know it's in the country and we know that this virus spreads quickly. And we are at a point where our healthcare system is already at the brink with flu season and sick people. And now we add this virus that spreads very quickly. We have to save our resources. So one thing that I also know is that we're at a point where people are really starting to panic, and the panic is actually doing a lot of damage, and it's time that we really stick to the facts. I've been getting a lot of phone calls of family members and friends that are really, really scared. And the thing that I tell them is that the numbers that you see are people who have been sick, not people who are in the hospital. And if you look at the amount of testing we've been able to do, that there are probably a lot of people who've already had it and didn't even know it, because this has been circulating in our community for a little while now. I'm up here in northern Idaho, right next to I'm 40 miles from Washington, and I know that it was circulating in Washington for a few weeks before they were able to really start testing. So we're also at the point where we do have testing capabilities, because remember, this was a new virus and it took a little while till we had the capability to test for it. So now we have that capability, and there's going to be a lot of tests, and I expect over the next weeks you will see the numbers double and triple, get very high of the amount of people who are testing positive. And then again, the thing we need to remember is that this is the time that we need to think of ourselves as a community, the first really important thing, and it becomes us and not me. Mm-hmm. And the second thing is we have to preserve the resources that we have for people who actually need life support and an ICU and a hospital. We also have to start thinking about the resources in the grocery stores, and what is that doing if I go and buy all the toilet paper out of Costco
Right.
to my neighbors as well? So that's where we are at. I think it's a time to stay calm and stick to the facts. The CDC has a really, really great website that is very user-friendly to the public. That is the best place to get your facts from, not your neighbor. So really know your facts and take care of each other is I think, where we're at, and expect the numbers to go very high in the next week or two. In the beginning of this virus, as it was new and emerging, we weren't really sure who was it going to affect and how was it going to affect people. We're still learning a lot about that, but we have a lot of information. And again, I'm going to refer back to the CDC website because you hear all of this talk about high risk, high risk, high risk. So what does that mean? It means that since this is a respiratory virus, if you have any underlying respiratory conditions such as asthma or COPD, heart disease, if you have to take blood pressure medication, diabetes, anything that compromises your immune system, you're high risk. One of the very general things that I hear a lot of questions about is age. What does the elderly mean? And what we know from previous viruses, and even with this virus, is that the elderly is really 60 and above. And I know that's a number I don't like because I'm very close to 60. We all have our various health issues. There are 85 people I know that are healthier than me, and there are 50-year-olds that are very unhealthy. But the data shows that as you get above 60, your immune system is not as strong. And then as you get above 70, there has been data that shows that you have increased likelihood of getting severe illness. And I think that's something else that needs to be clarified. So we have age. The older you get, the higher risk you are. Higher risk for what? Higher risk for getting a severe illness as opposed to the cold and flu-like symptoms that most of us will probably see.
What are you hearing as far as the latest, as far as how is this virus being transmitted?
The virus is transmitted by droplets. We know that. One of the reasons that the CDC suggested the N95s in the beginning was for extra protection for healthcare workers. So we know that it's droplet. What else is spread by droplet? Even though it's not good to compare this to influenza or the flu, it's a virus as well. So when you think about droplets, that's coughing and sneezing. That's the biggest way that it's transmitted. We're learning more about how long does it stay on surfaces, how long does it stay on food. That stuff is emerging. One of the things that I really like that the CDC explained was that they're talking about not social distancing, but physical distancing. And I think that's a better way to think about it. But 6 feet is a number that we get that you should be distancing. And then, maybe think about not hugging, not kissing, not touching your face, and that kind of stuff.
Okay. Some people have resorted to, like when they're buying groceries, say they'll, before they bring them in the house, they'll, spray the boxes or whatever with disinfectant. Is that something that you'd recommend?
I do not do that, and I'm pretty germophobic myself.
Mm-hmm.
What I do is I take my groceries and I unload them. And then I use alcohol hand sanitizer. If I don't have alcohol hand sanitizer, then I just wash my hands. I wash my hands with soap and water. I do have alcohol hand sanitizer, but I know a lot of people don't have it. So, but soap and water does very well. Just do it for 15 seconds, scrub your hands really good, and then that's adequate.
So what do you see, Gio, and what are you hearing from the CDC as far as the peak of this? I know it seems like the next 2 to 4 weeks is really kind of what they're watching on the graph as far as what they're calling being able to flatten this, or if it's going to, replicate some of the other countries that have really had serious outbreaks.
We don't know for sure, but what we hope is that if people really do this physical distance and stay home, that we're going to flatten this out. traditionally, when you have an outbreak, you have waves. We call it spikes in the epicurve, that you may see a spike and then you flatten out for a while and then you see another one. We're just hoping by all these things that we're doing, if we all do it well, that we can minimize those as well. And that is the best thing that we can do right now, because it is here and we all need to work together to help control it. However, we do not want to take a risk with the people that have underlying conditions that have higher chances of having a severe illness. And that's the thing to keep in mind, that I don't have any underlying risks. And I feel like it's my job to take care of my elderly neighbors and my family safely.
Yeah.
Since I don't have as much risk as them, I have been doing their grocery shopping and dropping things off at their porch and doing some minor repairs outside and helping with things. But I don't go visit anyone right now because it's just not worth the risk.
Right, I agree. I mean, my father-in-law Larry. I know you know him and love him very much. He's 80 years old. He lives with us, and Denise definitely has him under lock and key right now because he has some underlying health issues. So she's making sure that he's not doing any social interaction. Really appreciate your time this morning, Gio. I know that you said you've been taking a lot of calls from different people around the country, and thanks for just taking time to share some of your thoughts and your perspectives on this. And stay safe and well. Well, there you have it. That's my interview with our longtime friend, Gio Carducci, who has worked with the Center for Disease Control and is an expert in infectious disease. I hope you enjoyed that. We're actually going to try and do a Facebook Live in a few days, so watch for that on my Facebook. And also click on the link for the Center for Disease Control and check out their website, as Gio mentioned, because that's where you're going to get all the good and valid and correct information. Okay, I hope you guys are doing well and staying safe. Have a great day.